had a lot of registered participants, so I'm assuming people will be coming in as we go on. So if you want to move up, you're more than welcome to move up to the front. Don't be shy. Please join us up front. Anywhere. Okay. So we're going to kick it off because hopefully we have a very exciting session. Okay. So I'm going to start by introducing myself first. I'm Rania. It's my pleasure to have all of you in this very first session in the summit. We're going to be talking today with the Social Behavior Change Global Think Tank. It's an initiative of UNICEF headquarters in collaboration, of course, with our colleagues at regional and country level. So it's representing the social behavior change shift that's happening inside the organization. What we're going to do today is particularly talk with 5 of the 11 members of the Global Think Tank. And I'm not sure how much everybody knows about the Global Think Tank. I don't want to spend too much time on it, but maybe just to share a little bit of a background. The Think Tank initiative was launched about a year ago. A lot of thinking went into aligning the agenda around what's happening within UNICEF and the shift that we're trying to make during the development of the new strategic plan. Our strategic plan goes through cycles, and this one was launched at the beginning of this year. The idea behind having an external group of technical experts that could represent broader social, behavioral, as well as political sciences. So these are 5 of the 11 members, and there are many different disciplines that are represented within this think tank. We also have a group of research assistants. We actually have a group of about 4 research assistants and a secretariat of also 4 people. So there's been a lot of effort that have went into doing a lot of research, background, consultations. Many stakeholder consultations got us to today. And in effect, what we decided to focus on in this think tank, and that's what we'll be talking about today, is a focus on system strengthening. Can we go to the next slide? It was working, so please bear with us as we sort this out. There we go. Oh, we went too far. Yes, absolutely. So this is just a very simple framing of what we are trying to focus on. What we're aiming to do in the work that's happening within UNICEF right now is being more intentional about prioritizing social behavior change from the supply side, not just focusing on demand. The presentation will be available to everybody for sure, so we'll share this around. So the think tank was in a unique position to look at the different expertise across different sectors and to propose ways that help achieve social behavior change goals from a multidisciplinary lens. The main question we deliberated on, or we've been deliberating on for the last year, is what do we mean by system strengthening? And what is the best way forward? How do we use system strengthening as an anchor to what we want to achieve, which is really focused on changing the context in order to achieve SDG outcomes. So what do we need to do to achieve SBC outcomes that would contribute to achieving SDG outcomes? And particularly emphasizing our efforts on addressing the contextual and structural factors. Specifically, what we think we do in SBC is to better work with people and communities to increase their influence on the ecosystem of duty bearers, which includes government as well as civil society actors. And then we situate our challenges that we want to address through these different approaches that face people and communities to influence the larger systems and the local situations, which are always connected to national political processes and decisions, economic systems, as well as international issues. So our pillar and our anchor is system strengthening, and what the think tank focused on deliberating is how do we look at defining what we do within the greater scope of social behavior change to work on addressing changing the context. And I'll hand over to our panel that are going to take us through what we've been thinking about. And one last thing, I'll just ask the speakers to introduce themselves before we get into it.
Thank you very much, Rania. My name is Nisar Ahmed. I have come from India, have been working in the development sector. Maybe if we can give a quick round and then I'll start.
Colin Rainbow.
Hi, my name is Emma Muhammad from Malaysia.
Chris Dickey from NYU.
Alali Maegon from the Center for Sports and Human Rights, as well as current administrator of the Global Fund Project in Cameroon.
Thank you. Okay, so taking off from where Rania left, when we started work on our the system strengthening work and the social behavior change, so there were a couple of thoughts and just putting together whatever has been just. So there has been a global, actually, I get very nervous when I'm in the spotlight. So can I move away from the spotlight? Thank you. And that
recording in progress
and closer. So just to summarize the background that we had, so there was a global reckoning with there has been a legacy of institutional
recording stopped.
Racism. There has also been a legacy of colonialism, and because of that, many of the investment decisions, many of the SBC indicators have been affected. So somewhere talking about that how, what can we do and what can be done at the institutional level to prioritize things so that these things can be looked at when we look at the SBC programming. COVID-19, it has brought new challenges we all have seen, so we need to really talk about it. But it has brought a new way of knowledge management, a new way of learning, so somewhere that also needs to be incorporated into whatever SBC model that we are talking about. The current planetary crisis, pandemic, climatic issues, data safety issues, financial issues, so all those are going into the environment, which in any case is also affecting the results towards the SDG. So that's another very important aspect we thought that has to be done. And then it has to be a cultural transformation when we look at the SBC, rather than merely at the structure level. So overall, we together, we have seen SBC as a pathway to achieving the sustainable development goals. So that's the pathway for us. And with that in mind, and looking at the system, what Rania was talking about, so looking at social and behavior change with a systemic lens, okay, at the top of it, we do have our programmatic results, which will be there. So sectoral results, it could be on health, it could be on water and sanitation, it could be on child protection, whatever. Now the sectoral results we see having two sides. One is the community side, and then there is a programming side. Both together produce the results for us. And the subsection level, at these, the community side and the programming side, we have to have some investment which go on, and we have to have an evidence and measurement. So evidence and measurement, maybe at the community level, whatever is happening, collecting the evidences, and then using those evidences for the programming, and then the investment from the programming, which again will move towards the community. So both ways. And there, when we had the discussions, you'll see that the main word that we are saying, we are using the word communities. So we are not looking at just the community, we are also looking at the structures within the community, which hold them together. And investment, evidence and measurement and investment holding them together, we have the leadership and governance. And on leadership, the key word here is trustworthiness. We will talk a little more about trustworthiness when we come to the Collins. And all these three components put together, we are calling our SBC system strengthening, which produces some return on investment. So that's the overall framework which we are talking about and we are going to discuss today when we refer to SBC. So within this framework, I'll first come to evidence and measurement. So on evidence and measurement, two basic premises on the evidence and measurement. When we say that the approach that we are talking, that we have to have an ecosystemic approach, where we are looking at, and in contrast to what are the current models are mostly looking at individuals. So contrasting that with an approach where we look at individuals and we also are looking at the systems around those individuals. So the focus is on systems, so the individuals and community behavior, and then the changes in the system which are usually necessary. The second important approach is agency and strength-based. So we are saying that rather than looking at human behavior in terms of people being seen as those who would require some change, people as being seen as someone who require, someone who are constantly in need, or people who are passive recipients of various types of humanitarian aids. So look at those people as partners, so the human being, that people who are able to and who have capability to determine their own needs and their own plans to achieve them. So the whole belief in that agency of people, and based on strengths versus deficits, rather than looking at the deficits, what are the strengths on that side? So these are two very important aspects when we talk of evidence framework. And to take it forward, I'll request Emma to, I'll change the slide.
Thank you very much, Nisar. I also do not like spotlights, so I'll go down here. The four gentlemen there asked me to sit in the middle just to put more spotlight on me, but I'll run away from that. Can we go to the next slide, Nisar? So acknowledging the gaps that in the current measurement models of SBC, a case study was from Malaysia, the hashtag Kita Jaga Kita, community-led SBC is presented to highlight interesting key learnings and enhance an understanding of SBC and community empowerment. It emphasizes empirical and grounded lessons, which suggest communities themselves could have initiate change, and that this change from within is more sustainable than an outward intervention program, aiming to influence people to change. The case study is also an example of how society was able to motivate behavioral change organically to solve own problems and exemplifies their ability to take ownership and control of their future. So the hashtag Kita Jaga Kita, which literally means we take care of us, is a grassroots community-led SBC ignited by the people themselves as a response to those in need during the COVID-19 pandemic. It is a display of society's awareness and ability to be proactive and have a problem-solving attitude in dealing with issues faced by the community themselves. This hashtag was initiated by a member of the public as a means to reach out and help those in need during the pandemic. The community-led SBC movement started during the nationwide movement control order, the lockdown, where many were affected by the loss of income and had no channel to reach out for help. At the same time, the Malaysian government was struggling to cope with the rising cases, including limited supply of masks and PPEs for the healthcare workers. The backdoor change in the new government also, at the beginning of the pandemic, also brought about some trust issues to the government's ability to provide for the people. The hashtag became a way for the people to organize themselves and help solve these issues. People offered different contributions based on their multidisciplinary expertise. Some volunteered to sew PPEs, print 3D masks, conducted free online English lessons, provided counseling and mental health support, and donated money or food to those in need. The spirit of altruism echoed throughout the country. Can we move to the next slide? Nisa has shared earlier the importance of examining systems as many contributing factors that challenges individuals and communities to change from the ecosystem that surrounds them. An SBC approach should also acknowledge that human beings have the potential and agency to build their capacity and determine the future individually and collectively. This is an approach that is based on human strength rather than deficits, and we believe can be more effective and sustainable. There are 5 strategic focus or guiding principles that can be utilized as a thinking framework when we want to analyze a community-led SBC movement. These principles can be useful as a checklist to when we design SBC programs, as well as for measuring and monitoring programs that aims to build community empowerment. Drawing from the hashtag Kita Jaga Kita case study, we would like to show how these guiding principles can be applied to understand a community-led SBC. The first 2 strategic focus or guiding principles are multidisciplinary and multi-level. Individuals are nested in system or an ecosystem. So most of the contributing factors that challenge individuals and communities are from the ecosystem that surrounds them. Therefore, understanding the multidisciplinary and multi-level multi-level ecosystem and how people respond to this different ecosystem is crucial for community empowerment. For example, with the hashtag Kita Jaga Kita case study, we acknowledge that community responded to the need for them to support the health ecosystem and taking the lead to provide healthcare workers and frontliners with PPEs and face masks. We observe that the change in the political landscape has brought about some trust issues to the capability to provide for the people. The nationwide movement control order has also affected the economic system, and although the government has introduced many initiatives and incentives, there were still a lot of people who are affected economically. The global pandemic also affects local level. Not only communities' understanding of the disease, but also towards perceived risk, severity, and susceptibility. We need to acknowledge that local knowledge and cultural beliefs also affect local understanding of the issue. For example, misinformation on COVID-19 varies in different countries with different effects. In Malaysia, conspiracy theories about COVID-19 had less effect as compared to the West. Misinformation on vaccination had also a local and cultural context, for example, related to religious rulings and cultural beliefs. Can we move to the next slide? Thank you. Number 3 is multi-perspectives. Being inclusive and open to multiple and diverse perspectives can help us understand challenges from all stakeholders' perspectives, especially the individuals and communities that we engage with. Elevating cultural diversity to unite will release greater individual and collective wisdom and complementary capacities and capabilities. The multicultural society allows for multiple perspectives and solutions to solving the problem. Undeniably, there are challenges to manage and unite people with different beliefs. However, the hashtag Kita Jaga Kita values was successful as it was anchored in community collective spirit that cut across different communities and resonated well at individual and community levels, despite differences in religion, cultural, and socioeconomic status. The hashtag Kita Jaga Kita community-led SBC movement involves institutions and individuals from different disciplines, contributing resources and expertise to help communities to cope with the pandemic. People built a collective wisdom, complementary capacities, and capabilities to support social change that they want to see. The 4th one is challenging the current norm. The current approach that focuses on individual may be enhanced by including a systemic approach and by considering that the goal is not to influence people, but to better inform their individual and collective agency. We need to focus on fostering critical thinking and community empowerment. We need to be like gardeners, not bakers. Bakers mold the dough to conform, while gardeners ensure the environment is right for the garden to manifest its limitless potentials. The top-down approach that is often the traditional approach to designing and implementing SBC intervention programs has to be re-examined. What this case study has showed that when individuals are informed and feel invested with problems of the society, they develop a collective agency and increase in self-efficacy to solve communities' problems and help others. Therefore, the goal is not to influence people to change, but to empower communities themselves to initiate change themselves. The question that we need to ask is, how can we create a friendly ecosystem to facilitate this? Or how can we leverage from existing organic community-led SBCs, such as seen in hashtag Kita Jaga Kita? The aim of this entire process is to enable the individual and the community to regain and retain their holistic well-being, to take care of, and take charge of their future. Therefore, we suggest that understanding and prioritizing the ethnography and social reality of the individuals and community are central in determining factors and in co-constructing solutions to their challenges. In this case study, understanding how society responds to COVID-19 and what motivates people to initiate social change is important. Agency and strength-based focused efforts and creating an empowered ecosystem where people feel that they have the right and power to initiate change is important. More resources is needed, indeed, to fund studies to understand how organic social behavior change challenge existing SBC theories and support programs or policy development in order to strengthen systems or build meaningful collaborations between national partners and institutions. Leveraging from Malaysian spirit of unity in diversity, the case study showed that despite COVID-19 challenges, emotions surrounding Kita Jaga Kita movement were positive. People were spreading positive vibes and messages, expressing hope and trust that we will survive and thrive in the battle against the pandemic. There was also an increase in self-efficacy observed in the social media throughout the hashtag Kita Jaga Kita movement. We observed that the SBC created from within by the people themselves ignited a sense of community belonging, ownership, social capital, unity, and trust. Shared positive emotions and self-efficacy builds empowered society and behavior change that is more sustainable. The case study was an example for us to think using this framework and can be applied as a tool or checklist for SBC planners. It also invites stakeholders to look at different dimensions when analyzing social behaviors change. The case study is just an example, but we like to invite all of you to also think about the cases in your countries and drawing from diverse contexts across the world. We welcome your feedback and sharing to further improve the proposed thinking framework that we have. Over to you, Chris.
Okay. Well, delighted to be here with all of you. I am delighted that we could have a chance to share with you some of our thinking over the past year. And we really welcome your feedback to us. I mean, it's very important for us to get your thoughts on what we've worked on and how we can take it forward in a better way. And one of the areas is this idea of an investment case. Our feeling after this year, and actually after our whole careers up to this point, is that social and behavior change can be catalytic in improving outcomes. And when we compare it, because really it is being compared to other types of investments, more on the supply side, hiring more doctors, building more schools, building more clinics. The investment case on the supply sides are very robust. The investment case on the SBC side is not yet robust. And I think we're at a disadvantage. We all think we're at a disadvantage there. That if we can mobilize more resources toward SBC and have them applied in a way that's systemic rather than focused in one particular area or a few particular areas, that the outcome could be transformative and arguably bigger return on the investment than you would get by focusing entirely on the supply side. So that's our operating idea coming in, and we're welcoming you to challenge us on that. If you don't see it, or if you see ways that we can make it better, then we're counting on you to be able to give us that feedback. So if I could have this, just keep flipping through the slide. I'm not that good with slides, so you'll just have to bear with me. I don't use them very often. No, one before. Basically, what this slide before this should just tell you what I just said. Why is it catalytic? Well, because it operates across different sectors. That the impact of robust SBC programming has an impact not just in the behavior change around health interventions, but the outcomes are arguably, not even arguably, the outcomes are beneficial to other sectors, education, to policy, transportation, agriculture, you can name it, that there are benefits across the different sectors. We haven't yet counted those benefits accurately. And in fact, the inputs are, of course, from multiple sectors. You know, one of the slides that we just, in fact, what this think tank has been telling us is that behavior is determined by the structure, by the system, as much as it is by individual, you know, actions. And so if you really want to change behavior, then you have to start looking at the system itself rather than the individual. And that's where we've concentrated. So if you're looking at the system, you have to think about which components of the system are going to be important if you're going to try to engage in the behavior change strategy, social and behavior change strategy. You can go to the next slide if you'd like. We have, as Rania mentioned, we've got great research assistants with us. They did a literature analysis and they took a deep dive into 20 different studies. And what we saw, just to the point that I just made, is that the benefits go across different sectors. That if you look at the benefits of the SBC engagement, they go across the SDGs. It's not all focused on SDG 3. You can see benefits across the SDGs. And so one of the outcomes that Rania was talking about, and also Nisar, is that ultimately we are trying to improve our progress toward the SDGs, and we actually don't think we can get there without investing more in SBC. That's how we've seen it as a think tank. And then when we look at, no, we have to go back. And then when we look at where the investments have happened in SBC, we see that the majority of investments are in the SBCC, in the communication side, which is understandable because really I think that's where a lot of the investment has been done. But if you look at outcomes, we've seen outcomes, and I'm sorry this slide's so hard to read, but you can see outcomes in multiple sectors as well in addition to SBCC. So we can go to the next slide. We give a case study. I'm not going to go through it because I would really like to leave time for this conversation, but take a look at it. You can see that essentially we have outcomes that are related to the ones that we normally measure, but we also see that there are economic outcomes, there are health outcomes, there are education outcomes with this particular case study that we featured here. But go ahead and go to the next slide. This is a randomized control trial that took place in Uganda, but the benefits were measured beyond the types of benefits that we normally try to measure. This slide is really to try to show you that have the capacity. It's really not that well laid out because visually it makes you think that the impact investing is the lowest. The impact investing turns out to be the largest amount of money that's available. What that means is that we probably have to, or we definitely have to be able to engage with the private sector and with people that are really measuring financial impacts of their investments and returns on investments. And so we really have to get better at making the language appropriate for a new class of investors for us to be able to mobilize resources for what we're trying to do. And so that means we have to think about innovative financing mechanisms and innovative approaches so that we can show that there's a return on investment across sectors. And that may be the way to do that for them. But we'll welcome your feedback on that. Next slide, please. So this is the final slide. Essentially, we are looking at this human-centered, agency-driven, community-focused. When we talk about the type of evidence that we need, Emma told you about community-led SBC. In the year that we've been here, we've heard dozens of stories of community-led SBC. Those tend not to be documented. They tend not to be in a robust place where we can bring that into an investment case. We need it. So if you have evidence from community-led SBC, we'd really love to hear about it. There are many opportunities for collaborations to increase the evidence base that's going to be appropriate for investment cases, and we welcome that dialogue with you. As I mentioned, we need non-traditional capital sources. We're going to have to mobilize a lot of resources to do this. We're going to have to make a case that the investment in SBC is better. It gives a better return on the investment than some of the other investments that are in front of donors and decision makers and investors. And then we have to develop the right metrics to be able to show the impact across multiple sectors. So I'll leave it there. Hand it to my colleague Collins.
Good morning again, everyone. My name is Collins Ari Mbua. I'm with the School of Public Health at Georgia State University. I'm trying to change location because we have a habit of following the same pattern. So you heard the introductory comment by Rania that talked about the departing point or the departure for us was system strengthening. Part of what we had to do was to question the question, which is what does strengthening means? At what point might we strengthen? At what point might we change? At what point might we transform? And these are all a part of the process. We're starting from how we engage community, which is what Emma talked about, and you heard her talk about trust repeatedly in the work that we do in the community. And then you heard the investment case, a new way to understand the nature of partnership. A part of what we wanted to showcase was that none of this really matter if you don't focus on leadership and what leadership has to do. And the conventional way we talk about trust is to wonder when behavior does not change, why don't they trust us or trust what is being shared with them? So we're trying to say it's important to understand trust at the community level. The next slide. It's sort of a busy slide on the right side that we do want to continue to ask, that we do raise questions about trust. But charity begins at home when it comes to leadership. For every time a behavior does not change, it is not enough to ask, why don't the community trust? We want the leaders to be asking, are we trustworthy? What is it that we are not doing to not earn the trust of the community? And leadership trustworthiness become a central issue, and how we wanted to shed light on that convergence of anti-racism, decolonization, and COVID-19 that Nisa talked about at the beginning. If you look at this as like sort of busy, you have community on one side, and then you have system on the other side. And in leadership, we're not just talking about leadership at headquarters. We are talking about regions, partner agencies, and community level. That whatever we want to change or transform or strengthen has to be responsive to what the issues are at the community level. We have sufficient data to demonstrate that where trustworthiness is there, that is where leaders have invested and work on the importance of being seen as honest, sincere, open. Then you begin to see transformation, one that is sustainable in terms of behavior. And just two quick examples of how issue of leadership has been raised in the past several years. Before COVID-19, we had HIV/AIDS. At the height of HIV/AIDS, the then director, Peter Piot, was always calling, after years, attention to what he referred to as institutional behavior change. And we thought it was important, but it wasn't named. Because one of the things that we learned at the height of anti-racism and decolonization, you have to name the issue. You have to name it. He drew attention to it, but he didn't name it. In the past few months, the former head of US NIH, Francis Collins, has been lamenting the failure of scientific community and leaders to tackle the disinformation that has left 50 million people unvaccinated. And Kaiser analysis showing that 300,000 deaths resulting from disinformation. He did not name it. It's trustworthiness, leadership trustworthiness. So we wanted to talk about this and put this at the front and center in terms of the changes or transformation or strengthening that we are calling on has to start with leaders looking and reevaluating what they do, or what those of you who are here in leadership position, how you engage community and how you engage yourself. Next slide. And the key issue is we have some key recommendations that start with leadership inclusiveness, and which is to say that it requires those making decisions to be more diverse and inclusive than we typically see. And this may be a combination of the professional expertise who are sitting at this table. We're calling on more inclusion of social scientists and anthropologists. It's a clear case on example. And there are others who have been making contributions, drawing attention to the importance of this issue of trustworthiness. And then the other is in terms of having diverse representation, people who are committed to some of the issues that Emma talked about in how you engage community in a meaningful way to ensure meaningful change. And the commitment to action can be in form of not just a conventional training. There has to be a determined effort, as some major agencies are currently doing, to look within itself and say, indeed, what are we doing wrong? What are we not doing? You can't just strengthen if the foundation is weak. If the foundation is weak, then you have to transform. You only strengthen when there's already effort moving in the direction you want to build on what is there. And assessment and sustainable integration. We talk about investment case. We didn't want to leave the impression that the return on investment has to only be in terms of dollar. It's also in value, what we subscribe to, what the leaders believe is important. So bold and strategic leadership training that actually takes on racism and decolonization is one of the key foundational ways that leaders engage in bold and strategic training that leads to transformation. And the monitoring that we talk about in training, again, has to include a way of understanding that while we focus on evidence-based practice, there's also practice-based evidence, which is where the actual action on the ground inform the new reality and what we need to build on. So it's not just a case of, there are a number of cases we learn in COVID-19 where experiences on the ground is actually what we need to build on, not necessarily what has been established prior to the outbreak of COVID. So with that, I think that is the last slide. We'll hand over to Nisa to close out.
Thank you, Collins. So just to put everything together, this is where we begin. We have gone through what evidence and measurement component we are talking about. We have discussed just now about the leadership, and we have discussed the investment case. So overall, when we look at this, there are 4 major recommendations that this group has. I'll start from the investment. So the first and the foremost would be to build an investment case for SBC. So that's obvious. Talking about leadership, technical resources, so ensure that we put the technical resources to establish, strengthen, and maintain trustworthiness. Trustworthiness, as we said, that institutional trustworthiness. Since we are talking about establishing institutional trustworthiness, strengthening it and maintaining it. So an associated recommendation would be that what are the monitoring and evaluation frameworks which can be put in place to measure institutional trustworthiness on one side, and also to measure the return on investment for SBC or another. So that would feed into both these, the M&E frameworks. And lastly, the ecosystemic and strengths-based evidence collection frameworks to have the real line. So with these four recommendations, we would invite your suggestions, for which I'll request Irma to please come.
Okay, so you've heard them speaking. It's your turn. Okay, 5 minutes. We'd like you to talk to the person sitting next to you. What do you think about what you heard? Does it make sense to you? Does it resonate? 5 minutes. Talk to somebody sitting beside you. You have to ease over there. You can turn and face these guys. He's looking. Yeah. Does it make sense? What do you think about what you heard? When we started 15 minutes late, I have okay. All right. Okay. All right, so we got you started, but it's not over yet. It's not over yet. These 3 rows, you're going to be together. These 3 rows, now you're going to be together. Wow. And these 3 rows, they're with this group. They know who they are. Okay. These 3 rows, you're together. These 3 rows, you're together. You're with this group. You get to join them, and you join this group. Okay? So we have 6 more groups. So we got you buzzing, and we want to take you to the next level. So you're going to introduce the next level? It's up. Here, take it.
I think this is better. Oh, it's so much. Well, thank you very much, Emma. And yes, thank you all to all participants. I can see that the 5 minutes talk is going on very well. We don't intend to stop that, and that's why Emma is trying to put you in the same group. Please, in the next few minutes that you'll be talking to each other and considering each group, we will want you to focus on 2 questions. What do you, in your respective roles, need to do differently? And the second one is, what institutional changes where you work could facilitate the implementation of SBC programming? We'd like you to consider these 2 questions to have a deeper dive over the next 30 minutes, and perhaps then try to let us have conversation thereafter for the remaining time of this event. Thank you very much. The questions are still, I left on the screen.
5 minutes remaining. 5 minutes. Winding down, winding down. Last comments. Last comments. And you have a colleague that's trying to say something and we're winding down. So, rapido. Colleagues, it's that time. It's that time. It is that time. We only have a few minutes left together. Okay, we'd like to hear some of the discussion and the issues that surfaced. You've had think tank members in all of the groups and they've been taking notes, so we will capture that. But this is an opportunity. No more bees, no more kisses, no more hugs. Okay, this is an opportunity before we break to hear some of the observations that came out of your discussions. So I'm looking for anyone that would like to share what came out. Think tank members, please sit up front so you can make responses if there are questions or issues. Okay? Like to hear from groups. What was the discussion? What did you think about what you heard? And in terms of these questions, your respective role and what institutional changes, what kinds of things did you talk about? I need someone from a group. Okay, please, go ahead, Mario.
Thank you, Irma. I had to introduce myself, or? Yeah. Yeah, my name is Mario Mosquera. I am the regional advisor for Europe and Central Asia. Hi. And yeah, I am representing a group, very diverse group from Latin America, Africa, Asia, and yes, Africa, and India. Well, Asia. So some of the first question, the idea is to focus more on listening, sharing the voices from communities, working closely with communities, investing more in this community engagement. Some of the question is that came out is what communities we are talking about. Communities are no homogeneous group. There are different narratives, different discourses, different agendas. So how we are approaching this engagement when there are probably community groups or social movements that are questioning some human rights that probably, from the point of view of UNICEF, is not in harmony with our principles of human rights. The other part is the technology is not working. It's not working. Yeah. The other part is the institutional changes. We felt that there is a disconnect between HQ, regional office, and country offices. Country, within UNICEF, we are talking about institutional issues that we are, at country level, we are facing diverse challenges. And then at regional level and HQ level, we have diversity on priorities, human resource capacity. So these disconnect, because at the end of the day, what matters is what happened at country level. How the organization can restructure, rethink in a way that the whole energy is at country level. So how the upside down approach. So the other element is when colleagues enter in dialogue with government officials, policymakers, senior managers with the government, is that in some sectoral results, there are no evidence in terms of the economic argument, in terms of the timeline. Let me explain, if you have that interaction, do we have enough evidence to say if you make this investment and then you have this capacity in place, you will obtain these resources in an X time to achieve your results. We don't have evidence, probably in some areas like immunization, nutrition, it can be much clearer. So important, yeah. The last part, yeah, okay. The last word, yeah. So the elephant in the room is about the political economy. All of us operate in different political economy environments. We have to work in North Korea or in different places. I don't want to enumerate many of them. So the space for programming is different than working in other political economy structures. So this is very important that we can operate with the standards. We need to focus on the context, specific issues.
Okay. That's one group. Anybody else from another group? You have a mic up there? Okay, so we'll go to the front and then we'll.
comes up, okay, we need to hear the voices of the community, the families and the children. I would say I'm a pediatrician, I'm a social pediatrician. You need to listen. You are making UNCRC work. It's not going to work till you have child participation. It's not going to work till you have listening to the voices of children. Long, 1992, my country signed up. I don't think even a single law or policy change, the children have participated. That's one point that we made. Then we have a very interesting gathering with me. We had Jocelyn from the San Francisco, and she's done postdoc from UCSF, where I trained as well in my residency. But she spoke about men and boys. Quite true. You cannot achieve any of your rights till you remove this extreme violence that happens against women and girls. You know, she's talking about engaging with men and boys since 2008, and we didn't come to know about it till just this minute, and I've written a project. So one of the things that we've discussed, that besides her coming to India, is that we need to actually know, and we need to have some kind of communication within our own communities as to who is doing what. So that's one. And other is then Maria from Armenia came up with something very brilliant. You know, we need to work together, and the programs, we need to, capacity building, extremely important. You know, these frontline workers, how they work in these low middle income countries. I come from the global south. I'm presenting 4-nation study. This, you know, India, Pakistan, Kenya have been, and Sierra Leone. Same problems in all the global south countries. These frontline workers are so poorly trained, they're so poorly paid. I mean, how can you expect them to deliver? And the policy makers are sitting in the ivory towers making policies and, you know, not even reaching where they need to. So capacity building is extremely, and giving them respect and dignity is extremely important. This needs to change. Then Varsha had some great points, and I will so say, before I give all the points at Varsha and Reena, no, you have to say a few other things. Okay. No, I just wanted to say that what I want to do is to build the trust. So it's the last 5 years, we started a mobile health van, and as a medical doctor, instead of doing my patient care in my office, through my nonprofit, this mobile health van goes to 34 villages, and we have built trust. And because of trust, we got a free vaccine knowledge hub. A property was lying vacant, was given at no rent to us. Another child that I treated successfully was operated. That family gave me a gender resource center. So if you build trust with the communities, the communities also come forward to contribute because they need to. And if we want, it's all rights-based issue. I'm working on, human rights to children. Maybe all of you are from the other sectors, but child rights is extremely important, and we are creating a children's manifesto to be given to politicians when they come up, and we have created a association of civil society and training them on child rights, and most important, the access to vaccinations. I think childhood vaccinations should be a basic right of a child. Thank you.
Okay, I think most of the point is already covered, but I just want to highlight that what we discussed is, the role of SBC program. We do talk about it at the higher level, but when it actually comes to system strengthening, I mean, we are not clear about that. So I think it should be really make it very clear the role of SBC program when we talk about system strengthening, because system strengthening itself is a big tank. So I think that's where our group discussed about it. And as he already mentioned, that we really need to reinvest on capacity building of various stakeholders, right from government till the community level, every now and then. Every 3 months, the human resource changes or the personnel changes. We have to keep on doing that. So for that, we have to again invest on our program. So this is something, it's a cycle that goes on. So we should not stop that. And third, I think, I don't know if it's relevant, but I would like to really highlight that we talk about inclusive. To be inclusive, I think it's high time that even here, when we talk about think tank, we should really have community representative from LGBTQ as well as differently abled people. So I think that's where we should really start. And last is whatever theory or whatever, those big words we talk about communication here in these seminars. But when it translates at the community level, we have to really make it very simple. So if we can do the same thing here to understand what do we mean by simple communication in terms of talking about communication theories, I think we should really make it very simple, workable, doable. Thank you very much.
Thank you. We have another hand. You have the mic.
Hi, I'm, oops, sorry. Sorry. I'm Adelaida Trujillo from Colombia, and I've been tasked to share my notes on our discussion. We had colleagues from Cote d'Ivoire, Philippines, Malaysia, Humberto, who's Mexican, but he's based in Geneva, UNICEF, Jair and myself from Colombia, and our two colleagues from UNICEF, India, and MENA region from Istanbul, no? From Geneva also, yes, we're working in these areas. We had a very rich discussion. I think one of the basic points is that we share your concerns about, as Jair says, it's not a criticism. I think the process is really interesting, but perhaps acknowledging the traditions of discussing these issues that have been going on for years and incorporating these, for example, from the Latin America perspective, the cultural movements, the social movements, the participatory and community media discussions, and having them more at the forefront, not as if they were over there and leaders over there. It's just like this. I think there's a whole debate where we agree on the inclusion perspective and making it more, not as a, how you say, plañidera, as a complaint, but actually to just bring it up to the surface. I think that's a common point. Second point was very much on Humberto's and their colleagues in Geneva with a collective service, which brings together agencies and people already doing the work so that we are doing knowledge management, sharing, getting the best lessons learned, making the data come together, a participatory approach, a partnership-based approach. So this collective is an interesting, it's focused on humanitarian RCC, community engagement at the humanitarian level, but it's an example of multi-agency, diverse stakeholders' perspectives. The other interesting aspect of our group was a country-focused perspective from Philippines, being a USAID-funded project on sexual reproductive rights in pregnancy, and how the funding issue is a problem, and the universal challenge, access to health is something that needs to be embedded, thus connected to the system structuring, which was Humberto's very, very, very kind of strong point on we need to work on systems. And actually from the Latin America perspective, we believe deeply in that public sector, public government sector system is strengthening. And then my question was, okay, so what about public and private sector partnerships? You know, this investments focus on the think tank, how are we gonna deal with it? And my reply to your question was, as a CI, Latin America and Colombia-based, you know, we need to translate these terms. We need to clarify the terms. We need to translate into Spanish and get the debate at a, you know, at a regional level so that we are able to contribute more to the SBC discussion. And then the academia, our Cote d'Ivoire colleague and also from Malaysia and Norte coincided on the necessity to link this to the not only capacity building at the technical level, but the students, teachers, you know, getting these issues at the, you know, university from the ground up embedded. I'm not sure if I missed anything. There was a strong point on knowledge management, content management, and yeah, and getting the discussion going. And congratulations and thank you.
Hello. So, dear colleagues, finally, three kind of points from our group to summarize. So the first one is the advocacy. Like, how do we make the advocacy right with our own decision makers on this perception change? Because they perceive SBC as purely communication and to some extent community engagement. So do we have enough advocacy tools on this change that we could sell to our own decision makers? So, and as we said, SBC is often an outthought, and we are not often engaged in the broader strategic discussions where SBC could be the key priority. And we often say that SBC is discussed as part of the broader demand kind of side, but rarely discussed at the structural side or the environment side. So we want to kind of build up the case and say that SBC is actually the outcome level of our work, and that's why it should be kind of treated equally. And so that leads us to the second point on the capacity. So again, we need clear tools and capacity for partners. But what is more important is that we say that we want to, bring more anthropologists and science around SBC. But do the current SBC workers from the field have enough skills of policy design and integrating SBC into the policy level? Because we work in isolation from each other very often, so the key to success is to integrate SBC at the policy level. So do we have enough tools as SBC cohort to design programs and advocate for integration of, long-term mechanisms at the policy level? So these are the key highlights, and our colleagues provided way more in-depth comments in our discussions. Yeah.
Thank you very much. Are there any other groups that want to comment? If not, please.
Quickly. Yeah, just quickly, I don't want to repeat because many reflections are the same. Only a few. We need to first link our purely humanitarian, humanitarian sector with the real economists. Because what we miss in the conversation is people who understand how political economy works. And this is something we really need to think about. It's great that we know how to do SBC, but we don't know how to sell it. Second is the government and how the government is perceiving this area of work. And of course, the governments are very different and the countries are very different. But what's important is that many times it's a lot of effort to find the right counterparts in the government which could support us in achieving impact, not small results in sectors, but an impact at a high level. And that's one challenge. Another one is that we don't always have counterparts in local governments. So this is something which we should think about, because when you go to the local level, you can find, some countries, they don't have many people there, and they are completely overwhelmed. So how do we deal with this challenge? And the last one is on the donor side. So how do we convince, because the change in the donor perspective towards social and behavior change is happening slowly. Still happening, but it's very slow. How do we manage to convince the donors? And that's probably linked to the first point. How do we sell ourselves better? And how do we make sure that we are looking at the economical part of social and behavior change and not on the social, human, and so on? I think that's it. I don't know if colleagues want to add something. That's it from our side. Thank you.
Thank you. I'm quite aware of time, and we stole some time since we started late. Think tank members, you've heard some of the reactions from colleagues in the room. Any last comments you would want to make before we let them go? Precise, concise, and to the point.
So we also heard that we tend to be a little bit, we tend to emphasize health a little more than other sectors, but we're trying, as a think tank, we very deliberately looked across sectors, that we thought about SBC for education, for agriculture, for finance. It's not just health. And then the other comment is that we may not need to go for the entire apple on the investment case. What we may want to do is build investment cases to have SBC as part of other investment cases too. So just two final thoughts. So thank you. Any colleagues have anything else?
I think it's mostly to thank all of you, because listening to you, we are happy to note that you actually listened to us and you took the points into account in your deliberation. I like some of the terms, whether we're dealing with advocacy, the new way of framing what we talked about. Supply and demand side is one that came out strongly. But I think a point that came out in the group was 2 points, recognizing that the funding streams still tend to follow communication, how to ensure that we are dealing with social behavior change. And perhaps the other note that we have to think about is when we make an investment case, to be sure that it is not really pushing solely economic driver factor, that there are other value that we are striving for. So thank you for all the comments and feedback you shared.
Okay. Oh, Olawale, you want to say something?
Thank you. Well, like Professor Collins, I just want to thank everybody. I've taken my notes, but just 2 quick response. One, to the colleague that raised the issue of LGBTQ, to assure you that, yes, it's been factored in our deliberations within the think tank. And the second is, I've had comments about working in silos and silos. I think we can still improve things. And what I would just say is, if even we are in our different silos, can we break a kind of a window so that we see what other people in other silos are doing? And perhaps with that, we can start improving things until we break down the entire silos. So let's just create windows within our silos to see what is going on within our institutions so that we can do the right thing. Thank you.
Thanks, Olawale. Thank you so much. I know that we're already over time, so I'm not going to even attempt to answer all of the wonderful feedback and comments that we received. I do want to leave with parting thoughts. This is the first year, we literally just crossed 1 year of this global think tank. And thinking about what the next steps are, that's still things that we're also deliberating on. My contact information is shared in the presentation. We will have products that will be developed and produced, and we will be taking into account your thoughts and some of the comments also here. To continue the conversation, please reach out to me. Feel free to email me, and to be continued. I don't want to end it on a note beyond to be continued, because I think that these deliberations around what came out very strongly to me is, and it's been continuing, is how are we perceived at the highest level, right? Where is SBC? We say bring the chair to the table, where are we in that scope of influencing decision-making, financing, investment cases, and really raising the profile of SBC? I think we're on that journey together. And we want to continue that journey with all of you. So let's continue elevating SBC, doing our parts, and please feel free to reach out to me. And when we do disseminate, we will have all of the registered participants, and we will disseminate to all of you the products that will be coming out from this wonderful think tank. So if you have any questions, further feedback, please come back to me. Thank you, everybody. I appreciate everyone staying till the end. Thank you.